Hi there, welcome back to Amaize Health as we continue the journey to amazing health. I'm Dr. Thorpe Amaize. Thank you for joining me today. This week, we're continuing the conversation on screening tests. This time, we're discussing cancer screens. Now, most cancers do not have an associated screening test, but today I'm discussing the most commonly available screening tests that are mostly based on the American Cancer Society recommendations. I'm going to start off with breast cancer because that's the most common type of cancer with the most new cases diagnosed each year in the US. According to the American Cancer Society, at age 45 to 54, you should begin annual screening mammograms. When you're 55 or older, then you can switch over to doing it every other year. You have the option to begin at 40 based on your personal or family history. Please note that the recommendation from other groups may be different. In the Black or African American population, I encourage you to go ahead and get the screening mammogram or at least start the conversation with your doctor. The presentation is often later in the course of illness in minorities and have a higher death rate. If you have felt a lump or changes in the breast, please have a doctor evaluate it as a diagnostic test would be required. For cervical cancer screening in women or people with a cervix starting at age 21 years old, the American College of Obstetrics and Gynecology and the USPSTF do recommend pap smears. The frequency of repeat testing or need for additional testing is based on the test results. With normal results, repeat cytology or checking for the cellular changes, it's done every 3 years until the age of 29. From 30 to 65, cytology is done every 3 years if done alone. If HPV testing is done alone, then it's every 5 years. And if co-testing, meaning both HPV testing and cytology are done, then that's every 5 years. For colon cancer screening should begin at 45 years old with a colonoscopy or Cologuard, which is the test that we use to look for microscopic blood in the stool. In some populations, such as those with certain bowel disorders, your GI doctor or gastroenterologist will already have you doing regularly scheduled testing. For prostate cancer, which is the most common cancer diagnosis for men and the second most common overall, we start discussing and screening at age 45 years old in African American men and 50 years old for others. For lung cancer screening, we do this for smokers or former smokers who have quit within the past 15 years. We do an annual low-dose CT scan, and lung cancer is the third most common cancer. For each type of cancer screening, if you have multiple family members or first-degree family members, meaning a sibling or a parent with these cancer types, then the screening interval is likely to be different and maybe earlier, so please discuss this with your doctor. Today's takeaway points are: 1. Pap testing begins at 21 years old for anyone with a cervix. For number 2, mammograms for the breast cancer screening and Cologuard or colonoscopy for colorectal cancer screening are recommended starting at age 45 years old. Number 3, screening intervals may be different or earlier based on personal or family history, so make sure you have that discussion with your primary care doctor. Visit the USPSTF and the American Cancer Society website for more information on various cancer screening tests. Come back again next week and we'll continue the conversation on our journey to amazing health. To book me for a speaking engagement or to connect with us on social media, use @Amaize Health on Twitter, Facebook, and Instagram. Or connect with us on our website at www.amaizehealth.com. Continue to follow us on this YouTube channel. Be sure to like and subscribe. Again, this is Dr. Thorpe Amaize with Amaize Health. See you next time.